Plus, was this the moment that turned Michael Jackson into a painkiller addict? We're going to look at the relationship between serious trauma and drug addiction. Coming up, questions continue to swirl around the death of Michael Jackson. We're learning more about his alleged addiction to painkillers, and we're discussing what role trauma may play in sparking such addictions. Plus, new developments around Iran's post-election protests and the latest ahead. Well, as we know, prescription drugs appear to be at the center of the investigation into Michael Jackson's death, and some of Jackson's friends and family are saying it's what happened in this video that may have been behind his alleged addiction. Us Weekly released these pictures from that 1984 Pepsi commercial where Jackson's hair catches fire, dramatic pictures. And as a result of this injury, he was prescribed demeroll for the pain. And his friends say that when he was prescribed demeroll, it was the fast ticket to his addiction. Joining me from Dallas is Dr. Hal Urschel, author of Healing the Addicted Brain and founder of the Urschel Recovery Science Institute, an addiction treatment center in Dallas. And obviously here with me in the studio, my friend and psychologist, Jeff Gardere. Good to have you both with us. Dr. Urschel, I'd like to start with you. Trauma as a deciding event in one's life to get prescribed painkillers and open up the door to addiction. Is it a normal story?
You know, trauma, when you actually get hurt from trauma, where you actually experience chronic pain, luckily, most of the time you get chronic pain, you don't get addicted. In fact, only about 1% of the people that get treated with narcotics with chronic pain get addicted.
You know, I'm stunned when people talk. I'm stunned when people talk about giving him demeroll, because for those of us in the business, we know it's a pretty lousy pain medication, but it's a pretty easy one to get addicted to.
Well, you know, I don't think demeroll is any more addicting than OxyContin or Vicodin. Demeroll may have been a very appropriate medication because he may have been in a lot of pain with the second and third degree burns from his head. The problem is if that demeroll is continued to be given over a long period of time, and Michael Jackson had other psychological issues, anxiety, depression, the pain medicine sometimes will make those other psychiatric problems go away, and therefore the person keeps taking them, sort of self-medicating another problem with the drugs. And the longer you take the drugs, the higher chance you have of getting addicted. And
Jeff, that really sort of fits with the story. A guy who's hurting psychologically, physically, and it numbs the pain of having to deal with life.
That's right, because we're looking at the trauma not just being a physical trauma, but an emotional trauma too. And as the doctor has said, there were some pre-existing or what we call pre-morbid conditions of anxiety and depression that were already there. So it exacerbates those conditions. But also we have to look at this kind of trauma, the physical, the emotional trauma. It's outside of human functioning, which then causes the PTSD, post-traumatic stress disorder, where you have more anxiety and depression. So therefore it becomes easy to self-medicate or to get a doctor to get you those medications so that it can alleviate the symptoms. And as we all know, it really shouldn't be about the medication unless there's a chemical imbalance in the brain. It should really be more about the psychotherapy, and we don't really think that was going on.
Right. I mean, there have been reports of phenomenally large prescription drug bills. I mean, $100,000 a month.
That's right.
And reports of Michael Jackson used a lot of different aliases.
And then, shopping around.
Yeah,
exactly.
I mean, if you walk into me and you look like Michael Jackson, and you tell me your name is Jeff Gardere, I still know you're Michael Jackson.
Exactly.
I mean, my responsibility is to not give you what you want.
Well, but he was also sending subordinates in to get that medication. But Dr. Nancy, as you know, it's not that easy to forge an alliance with a physician in order to get your pain medications. Many of us, if we're good patients and we're a little bit smart, we're able to get that physician to be on our side. So if we just call the physician and say, I'm having this ache or pain, sometimes the physician may not tell you to come in. They'll say, you know what, I'll just go ahead and write you a prescription, get to the drugstore. So this is not rocket science as to how to manipulate your physicians in order to get the pain medication that you need.
You talked about celebrities. Yeah, go ahead, Hal.
You have to remember that addiction is a chronic brain disease. Once you get addiction, you actually have a variety of things going on in your brain that actually need to be treated. And if you're not getting the treatment appropriately in a comprehensive way, you're not going to get better. So one of the things you have to address is the psychiatric issues. One of the other things is the brain injury and the cravings going on in the brain. If those aren't being treated, you're not going to get better. Thankfully, with all the new scientific breakthroughs in addiction, if you get the appropriate treatment, you can have a 95% recovery.
That's right.
Celebrities like Winona Ryder and Jamie Lee Curtis have been very public about the fact that either after a trauma or after a procedure, they got access to these medications, liked them, and then the door was sort of open. How do you, Hal, as an addiction specialist, sort out the person who just sort of gets introduced to them and likes them versus the person who truly has this imbalance and their brain is rewired differently?
Well, again, I think it comes down to looking at a specific patient, and if that person is taking the medication as their pain physician prescribes and it's not abusing them in any way, which most people do. Again, only about 1% people get addicted to it, so 99% don't. Then they may like the way they feel, but they don't get addicted to it. But it's the people that do go to multiple physicians, buy the medications off the street or the internet, take more than their doctor prescribes, run out of their prescriptions early. If you have those types of symptoms going on, you have a much higher chance of having an addiction present. And that's not a bad thing. It just needs to be identified and be treated. The sad thing with Michael Jackson is it wasn't identified, it wasn't brought to bear, and many times celebrities with a lot of money are allowed to use those drugs and protect themselves. They insulate themselves from the consequences of stopping, and therefore their addiction actually gets worse and worse and worse, more than the average person.
That's why it's so important for physicians and other treating professionals to understand the personalities of the people that you're working with.
Yes.
If they do have these pre-existing mental conditions, be very careful as to how you prescribe.
And that's where physicians have to step up to the plate. It's an indictment of the medical profession, too. Dr. Hal Urschel, Jeff Gardier, thanks for being with us.
Thank you.
We will obviously be talking about this more next week. And a reminder, if you have any questions on addiction or anything else, send in your questions to me anytime. You can reach me at drnancy@msnbc.com or twitter.com/drnancymsnbc.